Hi, welcome back to our final episode on 21 things to avoid after rhinoplasty surgery. Today is the fourth and final episode. In the last episode and third part, we have discussed about touching your nose after rhinoplasty surgery and what foods to avoid after rhinoplasty surgery, and like hard foods and spicy and piping hot foods. And also we discussed about flying after rhinoplasty surgery and what clothing you should wear after rhinoplasty surgery. Hi, I am Dr.Sriprakash Vinnakota, Chief Rhinoplasty Surgeon, MicroCare ENT Hospitals, Hyderabad. In this episode, we will learn about what to avoid after rhinoplasty surgery. Last 6 things we are discussed. 16th one is stay out of the water for a month or more. Why? Because the swimming, even in pools or lakes, can increase your risk of infection after surgery. Pools harbor bacteria and open water is not anymore safer. The science behind it is the water pressure can put extra strain on your healing nasal passages, while chlorine and other chemicals can irritate delicate mucosa, slowing down healing. So what can you do instead of going to water swimming? Wait for at least 4 to 6 weeks before jumping back into the pool or ocean. If you really miss the water, try light showers instead of. Just keep your nose protected and avoid submerge. Use saline sprays to keep nasal passages clean and moisturized during recovery. Remember, patience now means smoother healing and fewer complications later. 17th one, don't ignore signs of infection. You should act fast after rhinoplasty surgery. White matters means if you notice redness, unusual discharge, or a fever after surgery, ignoring it can make things much worse. Small issues can quickly turn into serious complications. The science behind it is early detection stops bacteria from spreading into deeper tissues, which could save you from additional surgery or from longer recovery. You can check your surgical site daily for any changes in color, swelling, or discharge. Keep a thermometer handy to monitor your temperature. Contact your doctor immediately. Anything seems off. Early intervention is the key in this. Follow your post-op care instructions precisely, including wound cleaning, medication schedules. Always remember, quick action now can prevent bigger problems later. Number 18. Always stay clear of colds and flu after surgery. How can you avoid cold and flu after surgery? But why it matters? Sneezing, coughing, or blocked nose can put extra stress on your healing tissues. We don't want your recovery slowed down by unnecessary irritation, isn't it? The science behind it is when your body fights an infection, it releases inflammatory molecules called cytokines. These make blood vessels leak more fluid than usually, causing swelling, tissue fragility, and delayed healing. What can you do to avoid colds and flu? Wash your hands frequently, avoid crowded places, keep your home and surroundings clean and ventilated, boost your immunity with healthy meals, hydration, and sleep enough. That is also important. If you feel symptoms coming on, contact your doctor promptly. Early action prevents complications. Always remember, a little extra caution now means a smoother and faster recovery later. Number 19. Don't rush back to your routine too soon after rhinoplasty surgery, at least for 4 to 6 weeks of time. White matters means even if your nose looks perfect on the outside, it is still healing on the inside. Bones, cartilages, and soft tissues are gradually stabilizing. Jumping back to normal too quickly can affect your final result, because the bone remodeling and collagen formation continue for several months after surgery. Overexertion, heavy lifting, intense physical activity can disturb this natural process, potentially changing the shape of your nose and causing complications. What can you do to avoid heavy exercises or these things? The practical tips are: always take it slow. Avoid strenuous workouts, heavy lifting, or contact sport for at least 4 to 6 weeks of time. Listen to your body. Fatigue, swelling, or mild discomfort are signs your nose still needs care. Follow post-op guidance from your surgeon. Stick to your surgeons who advise of cleaning, medications, and follow-up visits. Protect your nose always. Be mindful of accidental bumps. Wear loose clothing and avoid crowded places if possible. Gradually resume activities. Start with light walks, gentle stretching, slow return to your normal routine. Always remember, patience now ensures a beautiful, long-lasting results later. Another thing after rhinoplasty surgery, 20. Don't skip your follow-up appointments. Why it matters? Follow-up isn't just paperwork, it's your safety check. Regular visits help your surgeon spot any complications early, so small issues don't turn into big problems. The science behind it is, after surgery, your body is busy healing, scar tissue gradually remodels, bones settle into place, and everything aligns properly. Skipping checkups means these changes go unmonitored, which can delay fixing problems before they become serious. What can you do? You can set reminders, schedule your follow-ups right after surgery, add them to your calendar. You can ask questions. Every visit is your chance to clarify doubts about healing or care. Track your progress. Take photos and notes on swelling, bruising, or discomfort to discuss with your surgeon. Don't wait for symptoms. Even if everything seems fine, your follow-ups are preventive measures. Remember, healing happens over time. Your follow-ups are your best tool to make sure it's smooth and safe. The last but not least, 21st point, don't judge your nose too soon. Why you should not? Because your rhinoplasty results aren't instant. They need time to settle. What's happening inside your nose is swelling slowly goes down as your lymphatic system clears fluid. Collagen matures, giving your nose the final shape. This can take up to 6 to 12 months of time. What can you do? Be patient. Avoid checking your nose in the mirror obsessively. Progress is slow but steady. Follow post-op care. Keep up with recommended icing, massage, cleaning routines. Take photos. Weekly photos help you notice subtle improvements without stressing over daily changes. Trust your surgeon. Your nose will reach its ideal shape in time. Early comparisons can be misleading. Always remember, beauty takes time and your new nose is no exception. Now, you have learned all 21 things you should avoid after rhinoplasty surgery. Remember, every small precaution adds up to smoother recovery, better results, and lasting confidence in your new nose. Thank you for staying with me through this series. I hope these tips help you heal safely and enjoy the outcome you have been waiting for after rhinoplasty surgery. If you found this series useful, please share it with anyone considering nose surgery. Give this video a like and subscribe to the channel for more expert advice on ENT health and facial aesthetics. This is Dr. Vinnakota from MicroCare ENT Super Speciality Hospitals, wishing you a healthy recovery and confident smile. See you in the next video.